Hey, it's Chris with ROE Dental Laboratory, and today we are highlighting our brand new book. It's an ultimate restorative guide for full arch protocols. And in this guide, it gives you different patient scenarios, and then it also tells you the different workflows you can use to get to your ultimate restorative outcome, which is a final fixed or final overdenture scenario for the patient. So in this book, there's different restorative protocols, and today we're specifically talking about the patented iJig. Now, what is the iJig? Well, it's a duplicate of the patient's prosthesis, but it is going to come to you sectioned. And so it'd be a fit verification jig. But the nice thing is it gets you the vertical, and then it establishes passivity all in the same jig. So you're not doing a separate bite rim to reestablish vertical. All we need for this is an intraoral scanner and a fixed prosthesis on multi-unit abutments. So there's going to be two different appointments. The first will be the record capture for the iJig. So what that looks like, again, it's all laid out in this book, and it's on our website as well, but I'll kind of briefly go over it. Patient comes to you, they're wearing their prosthesis, you're going to unscrew it, and then we can send you scan analogs, they're called, and you'll insert one of those scan analogs in each of the implant sites. Next, you'll take your intraoral scanner, and you're going to scan the edentulous ridge capturing the multi-unit abutments. From there, you take the prosthesis with the scan analogs and you do a 360-degree scan of that prosthesis. So now we have the implant positions and the prosthesis itself. Next step, you'll remove the scan analogs, reseat and screw in the prosthesis, scan the opposing, and scan the bite. We also want some photos, of course, a nice full face, full smile photo of the patient standing up. From there, you send us those records, and you're going to receive back the sectioned iJig. Again, it's a duplicate of what the patient's been wearing. Comes in sections. So then that appointment, it's a luting appointment. So you'll reseat the iJig after removing the patient's prosthesis, lute each section together, make sure it's all passive, lute it all together, and then you can give us a bite and scan the opposing. Some photos as well. And this is really a prototype of your final. So you could, depending on the records and the patient's speech and all that fun stuff, you could go to final from here, but most doctors go from there to a printed try-in, and then they go into the final. Now, there's one extra step to skip that sectioned iJig protocol where on the first records appointment, you have the analogs and the prosthesis. You can set those in stone. And again, this is all in this book. So I know I'm talking a lot here, but it's all in the book. But you can set those in stone and give us the stone model of the implant position. So then, instead of a sectioned iJig, you receive what is your printed try-in. So you're one step closer to your final. Any questions, of course, give us a call. You can receive this book, whether it's an ebook or a physical book, and it goes through all these different protocols. And of course, check us out on our socials for any new updates in the dental industry. Look forward to working with you.